Marketplace 101 provides a high-level overview of the Affordable Care Act and the health insurance marketplaces. It focuses on the federally facilitated marketplace, including state partnership marketplaces. This training presentation was developed and approved by the Centers for Medicare and Medicaid Services, the federal agency that administers Medicare, Medicaid, the Children's Health Insurance Program, and the federally facilitated health insurance marketplaces. This is an informational resource for our partners and doesn't create any rights or impose any obligations. It's not intended for press purposes. Members of the press should contact the CMS Media Relations Group at press@cms.hhs.gov. This is a summary of complex and technical legal standards. Official Medicare and Marketplace Program legal guidance is contained in the relevant statutes, regulations, and rulings. Health insurance plans in the marketplace offer comprehensive coverage from doctors to medications to hospital visits. Marketplace plans that provide medical benefits are called qualified health plans. Marketplace plans that cover only dental services are called qualified dental plans or standalone dental plans. You can compare all your insurance options based on price, benefits, quality, and other features that may be important to you in plain language that makes sense. A marketplace, whether operated by a state or by the federal government, is sometimes referred to as a health insurance exchange. There's a marketplace for small employers, too. It's called the Small Business Health Options Program, or SHOP. We'll briefly talk about SHOP later. This session focuses on the eligibility and enrollment process available through healthcare.gov, federally facilitated health insurance marketplace. With one marketplace application, you can learn if you can get lower costs based on your income, compare your coverage options side by side, and enroll. Through this one process, you can find out if you're eligible for qualified health plan coverage, premium tax credits to lower what you pay for your monthly health plan premium, cost-sharing reductions to lower what you pay out of pocket for costs like deductibles, co-payments, and co-insurance, other health coverage programs like Medicaid, a federal-state program which covers certain people with low income and resources, and the Children's Health Insurance Program, which covers certain children. The marketplaces offer competition and choice. Insurance companies are competing for business on a level and transparent playing field. Each state has substantial flexibility in ensuring its state has a marketplace that meets the needs of its citizens. States across the country received grants to support the establishment of marketplaces in their states. Some states established their own state-based marketplaces. A state may also decide not to establish a state-based marketplace, but opt for the federal government to operate a marketplace in its state. In states where the federal government is operating a marketplace, the state can opt to partner with the federal government. A partnership marketplace allows states to make recommendations for key decisions and help tailor a marketplace to local needs and market conditions. U.S. territories can decide whether to establish a marketplace or expand Medicaid coverage. Residents of a U.S. territory that creates a marketplace can only enroll in plans in their territory's marketplace. They aren't eligible to apply for health insurance using the federally facilitated or a state-based marketplace. A qualified health plan, or QHP, is an insurance plan that is certified by the marketplaces, provides essential health benefits, follows established limits on cost sharing like deductibles, co-payments, and out-of-pocket maximum amounts, and meets other requirements. A QHP must be certified by each marketplace in which it is sold. Additionally, a QHP must be offered by a health insurance insurer that is licensed and in good standing to offer health insurance coverage, agrees to offer at least one QHP at the silver level and at least one plan at the gold level in a marketplace, agrees to charge the same premium rate for each QHP without regard to whether the plan is offered through a marketplace or directly from the issuer or through an agent. Agrees to offer a zero-cost sharing or limited cost sharing variation to American Indians and Alaska Natives in any plan category. The Affordable Care Act provides for the establishment of an essential health insurance benefit package that generally is equal in scope to the benefits covered by a typical employer plan and cover at least the following 10 general categories: ambulatory patient services, outpatient care you get without being admitted to a hospital; emergency services; hospitalization, such as surgery; maternity and newborn care, care before and after your baby is born; mental health and substance use disorder services, including behavioral health treatment. This includes counseling and psychotherapy; prescription drugs; rehabilitative and habilitative services and devices to help people with injuries, disabilities, or chronic conditions gain or recover mental and physical skills; laboratory services; preventive and wellness services and chronic disease management; pediatric services, including oral and vision care. Pediatric oral service may be provided by standalone plan. Plans in the marketplaces are separated into 4 health plan categories: bronze, silver, gold, and platinum, based on the percentage the plan pays of the average overall cost of providing essential health benefits to members. The plan category you choose affects the total amount you'll likely spend during the year. Each plan category is associated with an actuarial value, which represents the percentage of the total allowed costs of benefits paid by the plan. For example, if a plan has an actuarial value of 70%, on average, you would be responsible for 30% of the costs of all covered benefits. The health plan categories are as follows: bronze level, a health plan that has an actuarial value of 60%. Silver level, a health plan that has an actuarial value of 70%. Gold level, a health plan that has an actuarial value of 80%. Platinum level, a health plan that has an actuarial value of 90%. However, you could be responsible for a higher or lower percentage of the total costs of your covered services for the year, depending on your health care needs and the terms of your insurance policy. Catastrophic plans are health plans that meet all of the requirements of qualified health plans but don't cover any benefits other than 3 primary care visits per year before the plan's deductible is met. The premium amount you pay each month for health care is generally lower than for QHPs, but the out-of-pocket costs for deductibles, co-payments, and co-insurance are generally higher. To qualify for a catastrophic plan, you must be under 30 years old or get a hardship exemption because the marketplace determined that you're unable to afford health coverage. Each member of a family must meet the eligibility requirements to purchase a catastrophic plan. People who enroll in catastrophic health plans aren't eligible for premium tax credits to lower their monthly premiums. To be eligible for marketplace coverage, you must be a resident of a state served by the marketplace, be a citizen or national of the United States, or a non-citizen who is lawfully present in the U.S., not be incarcerated other than incarceration pending the disposition of charges. Eligibility information on the application is verified through electronic data checks with the IRS, Social Security Administration, the Department of Homeland Security, and other electronic data sources approved for eligibility verification. If you meet the eligibility requirements to purchase a qualified health plan through the marketplace, you're considered a qualified individual. There's no waiting period, such as in Medicaid, that provides eligibility after you have lived in the U.S. for a set period of time. If you have a student visa, you may be eligible for coverage through the marketplace, but not for Medicaid or CHIP. When you use a marketplace, you may be eligible to receive advance premium tax credits paid directly to the issuers that may be used to lower your monthly premiums and cost-sharing reductions that lower your out-of-pocket costs. The premium tax credit is generally available to individuals and families with household incomes between 100% and 400% of the federal poverty level who don't have access to certain other types of minimum essential coverage. Remember, minimum essential coverage includes government-sponsored coverage like Medicare, Medicaid, CHIP, some VA coverage, and TRICARE, affordable employer-sponsored insurance, meaning the cost for the employed individual is no more than 9.66% of their income, and certain other coverage. If you enroll through an individual marketplace, you may be eligible to receive premium tax credits, which you can use to reduce the cost of monthly premiums for yourself and your tax dependents. You can choose to receive a portion of the credit each month as an advance payment of the premium tax credit, with reconciliation at the end of the year. Advance payments are paid directly to qualified health plan issuers on a monthly basis. People eligible for a premium tax credit who don't receive an advance payment of the premium tax credit may claim the credit on their income tax return filed for the coverage year. People who are married at the end of the coverage year are required to file a joint return to receive a premium tax credit. A tax filer who receives advance payments is required to file a tax return for the coverage year to reconcile any advance payments of the premium tax credit with the premium tax credit allowed on the return. If the premium tax credit allowed on the return is more than the amount of the advance payment of the premium tax credit, the person may receive the excess amount as a tax credit. On the other hand, if the amount of the premium tax credit determined based on the annual household income and family size on the tax return is less than the amount of the advance payment of the premium tax credit, the person will be responsible for repayment of the excess amount. The marketplace will provide documentation to the tax filer and to the IRS that will support the reconciliation process in the same way that an employer or bank provides a Form W-2 or Form 1099. You should report all changes to the information in your application, such as marriage, divorce, birth, eligibility for affordable employer coverage, and increases and decreases in household income as soon as possible to avoid owing money after reconciliation on your tax return. Cost-sharing reductions are available to help reduce your out-of-pocket expenses, including deductibles, co-payments, and co-insurance. To be eligible for a cost-sharing reduction, you must have a household income that is less than or equal to 250% of the federal poverty level, meet the requirements to enroll in a qualified health plan, receive the premium tax credit, and enroll in a silver-level plan. Members of federally recognized tribes, shareholders of Alaska Native Regional and Village Corporations, California Indians, and persons of Indian descent who are eligible for services from the Indian Health Service, tribal programs, or urban Indian health programs who purchase health insurance through the marketplace, regardless of plan category like bronze or silver, don't pay premiums and cost sharing if their income is under 300% of the federal poverty level. To qualify for Medicaid, you must belong to one of the eligible groups specified under the federal Medicaid law. These groups include pregnant women, children, people with disabilities, seniors, parents, and caretaking relatives. To be eligible for federal funds, states must cover people in certain groups up to federally defined income thresholds. However, many states have expanded Medicaid beyond these thresholds and have extended coverage to other optional groups. There are financial and non-financial requirements that must be met. The Affordable Care Act established 3 new Medicaid eligibility groups that made health insurance available to millions of people who weren't previously eligible. The new adult group covers certain individuals, 19 to 64, with income below 133% of the federal poverty level, including 19 and 20-year-old children. To be eligible for the new adult group, individuals may not be entitled to or enrolled in Medicare. They can't be eligible for any other mandatory Medicaid eligibility group, and they may not be pregnant at the time of enrollment. This group is a mandatory eligibility group that states can elect to cover. A second eligibility group created under the Affordable Care Act generally established Medicaid coverage for individuals under 26 who were enrolled in Medicaid while they were either in foster care at 18 or when they aged out of foster care. There is no income or resource test for this eligibility group. The third group is similar to the new adult group. Individuals in this group must be under 65 with income above 133% of the federal poverty level and can't otherwise be eligible for another Medicaid group. Unlike the eligibility requirements for the new adult group, individuals in this optional group may be pregnant or may be eligible for Medicare. In addition, this group covers both children and adults who aren't otherwise eligible for Medicaid. The first step in the application and eligibility process is to submit an application to a marketplace. You can apply online, by phone, by mail, or in person. When you complete the application, your information will be verified, including residency, that you live in the service area of that marketplace, your incarceration status, American Indian Alaska Native status, household income, household size, and eligibility for other essential coverage, including employer coverage or government programs like Medicare, Medicaid, CHIP, VA, and TRICARE. This information is checked electronically against the data of Social Security, the Internal Revenue Service, the Department of Defense, Department of Homeland Security, and other approved electronic data sources for verification. Anyone who submits an incomplete application through healthcare.gov will receive a notice and have 90 days to provide the needed information. State marketplaces could have fewer days. You may be determined eligible to purchase and enroll in a qualified health plan through a marketplace or enroll in Medicaid or the Children's Health Insurance Program. If you're eligible to enroll in a qualified health plan in a marketplace, you will also find out if you're eligible for a premium tax credit and cost-sharing reduction. The Affordable Care Act requires all applicable individuals to obtain minimum essential coverage or pay a fee, shared responsibility payment. Everyone must have minimum essential coverage, have an exemption from the shared responsibility payment, or pay a fee. If you have minimum essential coverage, you don't have to do anything. You're already covered. If you qualify for an exemption for a month, you won't have to pay the fee even if you don't have coverage. But if you don't have coverage and don't qualify for an exemption, you have to pay a fee. If you have coverage from any of the following, you have minimum essential coverage and you don't have to do anything. Employer-sponsored coverage, including self-insured plans, COBRA coverage, and retiree coverage. Coverage purchased in the individual market, including a qualified health plan offered by the health insurance marketplace. Medicare Part A coverage and Medicare Advantage plans. Most Medicaid coverage. Children's Health Insurance Program, or CHIP coverage. Certain types of Veterans Health coverage administered by the Department of Veterans Affairs. Most types of TRICARE coverage. Coverage provided to Peace Corps volunteers. Coverage under the Non-Appropriated Fund Health Benefit Program. Refugee medical assistance supported by the Administration for Children and Families. Self-funded health coverage offered to students by universities for plan or policy years that begin on or before December 31, 2014. State high-risk pools for plan or policy years that began on or before December 31, 2014. Other coverage recognized by the Secretary of HHS as minimum essential coverage. Minimum essential coverage doesn't include coverage providing only limited benefits, such as coverage for only vision care or dental care, and Medicaid covering only certain benefits, such as family planning, workers' compensation, or disability policies. You should always check with your plan to see if it qualifies as minimum essential coverage. If you don't have minimum essential coverage, you may have to pay a fee. You may be exempted from the fee for any of these reasons: religious conscience, membership in a recognized healthcare sharing ministry, membership in a federally recognized tribe or eligible for services through an Indian health services provider. You have no tax filing requirement, meaning your household income is below the minimum threshold. You have a short coverage gap of less than 3 consecutive months. You suffered a hardship, which is a circumstance that affects your ability to purchase health insurance coverage, like being homeless or recently experiencing domestic violence. You have unaffordable coverage options, meaning the minimum amount you must pay for premiums is more than 8.13% of your household income. You're incarcerated, or you're not lawfully present. You're neither a U.S. citizen, a U.S. national, nor an alien lawfully present in the U.S., or your health plan was canceled and there is no affordable coverage option in the marketplace. If you have 2 short gaps in coverage during a year, the 3-month gap exemption only applies to the first gap. Visit healthcare.gov/exemptions for more information. When an uninsured person requires urgent medical care but doesn't pay the bill, everyone else ends up paying the price. That's why the Affordable Care Act requires all people who can afford it to take responsibility for their own health insurance by maintaining minimum essential coverage or paying a fee, shared responsibility payment. Paying the fee doesn't provide health coverage. You can only enroll in or change a marketplace plan during the open enrollment period or during a special enrollment period if you qualify. For coverage in 2017 and 2018, open enrollment will begin on November 1st of the previous year and run through January 31st of the coverage year. For coverage in 2019 and beyond, open enrollment will begin on November 1st and end on December 15th of the preceding year. For example, November 1st, 2018 through December 15th, 2018 for 2019 coverage. If you experience certain qualifying life events or other qualifying changes in circumstance, like moving if it gives you access to new qualified health plans, getting married, a change in income in some cases, or getting citizenship, you can qualify for an SEP. If you're eligible for Medicaid or the Children's Health Insurance Program, you may enroll at any time during the year. If you're a member of a federally recognized Indian tribe or an Alaskan Native shareholder, you can sign up for or change plans once per month throughout the year. If you have a qualifying life event, you can enroll during a special enrollment period. You can log into your account on healthcare.gov and click on the Report a Life Change button. You can also call the Marketplace Call Center to request a special enrollment process. Remember, most special enrollment periods last 60 days from the date of the qualifying life change in the individual marketplaces and 30 days in the Small Business Health Options Program marketplaces. There are 4 steps to using the federally facilitated and state partnership marketplaces when enrolling or renewing coverage during open enrollment. Create an account. First, provide some basic information. Then choose a username, password, and security questions for added protection. Apply. Next, you'll enter information about you and your family, including your income, tax household size, other coverage you're eligible for, and more. Visit healthcare.gov to get a checklist to help you gather the information you'll need. Pick a plan. Next, you'll see the plans and programs you're eligible for and compare them side by side. If requested, you'll also find out if you can get lower costs on monthly premiums and out-of-pocket costs. Enroll. Choose a plan that meets your needs and enroll. If you have any questions, there's plenty of live and online help along the way. Once you select a plan and enroll, you must pay your first premium directly to the insurance company, not to a marketplace. Each insurer sets its own payment deadline. Some insurers may accept your first payment after your coverage has become effective or pay for your care retroactively. If you don't pay your premiums, your enrollment may be terminated by your issuer. There's a 3-month grace period for you if you're receiving an advanced payment of the premium tax credit as long as you paid at least one full month's premium. Issuers must accept these payment methods: paper check, cashier's check, money order, electronic fund transfer, prepaid debit card. Some issuers may also accept online, credit card, and debit card payments. You're free to end your enrollment in a qualified health plan at any time. No special enrollment period is required. To do so, you must terminate your federally facilitated Marketplace enrollment through the Marketplace and specify the effective date of termination as long as it's at least 14 days in advance. However, if you go for 3 months or more without minimum essential coverage and don't qualify for an exemption, you may have to pay a fee. If you don't agree with a decision made by the Health Insurance Marketplace, you may be able to file an appeal. You can appeal the following kinds of Marketplace decisions: whether you're eligible to buy a Marketplace plan, whether you can enroll in a Marketplace plan outside the regular open enrollment period, whether you're eligible for lower costs based on your income, the amount of savings you're eligible for, whether you're eligible for Medicaid or the Children's Health Insurance Program, whether you're eligible for an exemption from the Individual Responsibility Payment fee. If you have questions or need help applying for coverage, there are resources including toll-free call centers and websites with plan comparison tools. There's also Marketplace-approved in-person help available through several programs to help you with the process of enrolling and using health insurance, including the Navigator program. Use the Find Local Help tool at localhelp.healthcare.gov to find local, personal help applying for health coverage. Language assistance is available through interpreters, call center support, and print and web resources. Help is available to complete an application. Job aids are available in 33 languages at marketplace.cms.gov. There's a national Marketplace call center for consumers who live in states operating federally facilitated and state partnership marketplaces. When you call, you'll be asked what state you live in. The number for the Marketplace call center is 1-800-318-2596. TTY users should call 1-855-889-4325. Customer service representatives are available 24 hours a day, 7 days a week, including New Year's Day. The call center is closed on Memorial Day, the 4th of July, Labor Day, Thanksgiving, and Christmas. Customer service representatives can help you complete the entire application and enrollment process from beginning to end with information you provide over the phone. They can also answer questions as you fill out an online or paper application and refer you to local help resources in your community. The call center provides information in English and in Spanish. It also uses a language line to provide assistance for more than 240 additional languages. The Small Business Health Options Program call center answers shop questions Monday through Friday, 9 a.m. till 7 p.m. Eastern Time. Medicare isn't a part of the health insurance marketplaces. Medicare Part A provides minimum essential coverage. If you have Medicare, you don't have to do anything related to the marketplaces. The marketplaces don't change your Medicare plan choices or your benefits. Medicare plans and supplemental policies, also called Medigap, aren't available in the marketplaces. It's against the law for someone who knows that you have Medicare to sell or issue you a marketplace's policy. This is true if you have only Medicare Part A or Part B. The exception is coverage from your employer, including through the Small Business Health Options Program. From Coverage to Care is an initiative to help people with new healthcare coverage understand their benefits and connect to primary care and the preventive services that are right for them. The Enrollment Toolkit at marketplace.cms.gov/C2C can help you learn more about what you need to know before choosing and enrolling in a plan, including information on copayments, deductibles, and financial assistance. Once enrolled, the Roadmap to Better Care and a Healthier You provides help on using your insurance, finding a doctor, and receiving primary care and certain preventive services. You can get up-to-date information about the federally facilitated health insurance marketplace at marketplace.cms.gov. There's access to consumer materials, training materials including videos, research, and more. You can sign up for updates as well. This is also where organizations can apply to become certified application counselors and champions for coverage. Need more information about the health insurance marketplace? Sign up to get email and text alerts at healthcare.gov/subscribe. Cuidadodesalud.gov/es provides the healthcare.gov information in Spanish. Updates and resources for partner and stakeholder organizations are available at marketplace.cms.gov. Like us on Facebook and follow us on Twitter.